Hey, my dear friends, you're welcome, dear listeners, and our friends around the world, in Nigeria and around the world. This is Vital Health International, a health conversation to help you eat healthy, live healthy, and feel healthy, and spend less money on doctors, on hospital fees, and on medical bills. It is my desire and our desire as we go on to help you live out your life on earth as God planned for you to live out. That's why this health conversation is coming your way. And I do hope that by the end of this program and in the subsequent weeks, you will learn a lot. Well, we're going to go on break. But before we do that, I would like us to look at some of the other things that one can do when they have high blood pressure. Okay, you've talked about their diet, right? You've talked about their exercise. You've talked about medication. What about anger management? What about good sleep habits, right? What about, taking fruits? And so tell us.
Okay. So one of the issues and challenges we have these days is sleep.
Yes.
Sleep. And my friends and I joke and we tell ourselves that, we are, what do we call it? Insomniacs. We are people that do not sleep.
Mm-hmm.
But it's common that in our age when we are striving to settle so that in our later years we have enough to take care of us, and at this point we have enough to take care of our children, we are staying awake, we are thinking and dreaming, and we are seeing visions. And also for some women who are perimenopausal, they might be having hot flashes, and some people it's just anxiety keeping them awake. But sleep plays a big role.
Yeah.
If you're not sleeping well, you're not going to be resting well, and then your blood pressure will go up. And also stress.
Yes.
Stress. So this is why I tell people, if you know you can't watch the news without getting angry or without getting sad, please read your news. Read your news. There are some people
Without getting
that
worried.
Okay. Yes, there are some people that are okay be watching the news and they watch it and they are fine. But if you know you're not one of those people, read your news and choose which information you want to put inside you so that you're not getting upset.
Yes.
When you get upset, your blood pressure goes up. And you say some people, they say, oh, he was so angry, and he just fell down and died. Probably had a stroke because his blood pressure was uncontrolled,
Yes.
and then he was stressed, he didn't sleep, and that happened. So sleep is very important. So you say for an adult, you should sleep at least 8 hours of uninterrupted sleep.
Hey, my dear listeners, I'm glad you are back to this program of Vital Health with Dr. Tarkon. I am your host, Dr. Tarkon. Vital Health International is a program to help you eat healthy, live healthy, and feel healthy, and spend less money on doctors, on medical bills, and on hospital fees. It is our desire that you would live out your days on earth. You will accomplish the purpose why God put you here. And that's why we are bringing this health education program to you. It's a health conversation, just so that you get to know what you need to know and you make adjustments as is necessary. Now, the reason why I am back on air is not just because of Vital Health International. It's because of a new program, medical intervention program that it's been around, but now we are bringing it, or the managers and the medical team is bringing it to you where you are. And the CEO, Dr. Toyin Opeilami, is here with me in the studio. I'm sure some of you listened to last week's broadcast. She's here with me in the studio, and we are going to be having another health conversation. Okay, Dr. Toyin, you're welcome.
Thank you.
Okay, good. Now, I'd like to give you these phone numbers. I would like you, if you're writing, I'd like you to take down, I would like you to write down because you may not remember them. It's important for you to have these numbers because it will help you. That's one way you can reach her. Dr. Toyin is the CEO of TelMed, TelMD. TelMD is called TelMed, and this is the way you can reach them: 0707 660 7330, 0707 660 7330. I'll take that one more time: 0707 660 7330. And you can also reach her and her team on Instagram at TelMDNG. Tel, T-E-L TelMD NG for Nigeria, TelMD NG. You can also reach the whole team, TelMD team, on Facebook. You can reach Dr. Toyin on Facebook, TelMD, TelMD, and on LinkedIn, TelMD Nigeria. TelMD Nigeria, you can reach them that way. And for some of you who still have my contacts and you want to reach me, you want to reach them through me, trust me, your message will get to them at Dr. Joe Tarkon, at Dr. Joe Tarkon on IG. Tarkon is spelled as Tarkon. Dr. Toyin, glad to have you. Once again, I want to ask you, I know you said this at the beginning of this program a couple of weeks ago when we went on air. Do you want to tell me what was your motivation for this?
I have a lot of motivations, but the primary thing that took me into telemedicine was the convenience of it. Being able to care for my family and being able to care for my patients and being able to do everything conveniently. So I found telemedicine a way to be able to work from anywhere, work from home, take care of my child who was in and out of school with colds, and also be able to take care of my patient even though they were not right in front of me. Yes. So it's the convenience of telemedicine. That's why I do telemedicine. And why am I taking telemedicine to Nigeria? It's to be able to help Nigerians see or get quality health care, to provide more access to quality health care, and to make quality health care affordable for Nigerians.
Wow, that's good. That's good. Now, you say taking it to Nigerians. Are you a Nigerian? Because you don't look like. You do not look like a Nigerian.
I am Nigerian. My father was Ekiti.
Oh wow, Ekiti, because you look more like a Caribbeanese. I mean, you lived in the Caribbean, right?
Yes, I did live in the Caribbean. I lived in Trinidad and Tobago for about 3 years.
Wow. So do they speak a special English there, like the?
They speak English, but it has an accent, and then they have their own. What's it called? Is this slang? They have their own.
Is it Creole?
It's not Creole.
Okay.
It's still English, but they have their, what do you call that? It's like when you don't, like pidgin for Nigeria.
Oh, okay.
They have their own,
okay.
that they can lose you
when
they are talking. But it's still some form of English.
Okay.
But they do speak English.
You know how to swim, right?
Yes, I do.
Did you learn it there, or you learned it before you got there?
No, I learned it in Nigeria, actually.
Wow.
Then I got to the United States, then I did lessons again just to be sure I could float. Because even though I could swim, I was sinking. That was not swimming.
No,
so
that was not swimming. No. You didn't know how to swim if you sink. I mean, that's not swimming.
Yes.
You know how sometimes our children will tell you, I can swim, and then
they'll go down like a rock. Yes, that was me going down like a rock, even though I could move in water. But now, yes.
Okay, yeah. So you see, because the reason why I asked you this question, I want our listeners to know that I have been very impressed by the TelMD program. I've been very delighted that you are doing this for our people, because you know the limited resources that our people have to go to the hospital, or even when they get to the hospital, they are not getting the best of treatment. They are not getting the best of treatment in view of the resources that are available, and in view of even the resources that they have to get this treatment for themselves. So they are concerned about privacy and all that. And what telemedicine is doing, it's giving them that privilege, that opportunity to get the treatment they want, even in the privacy of their houses, right?
Yeah.
So like you said, all they need is their phone or their tablet or their computer, right?
Yes. And the great thing about TelMD, aside from the access, the convenience, meaning you can book an appointment for whenever it's convenient for you.
Yes.
It's as though a concierge service. So if we offer primary care, this is a big
because
thing.
you're a primary care physician.
I'm a primary care physician.
Yes, so
if you have a doctor, primary care is all about continuity. That means it's your doctor you continue to see. Your doctor knows you.
Yes.
So if you have a doctor and you both see today and say, okay, we're meeting in 3 months. Oh, 3 months. Maybe can we meet at 9 p.m.? Yeah, that will work for you, work for me.
Yeah.
Yes. So to me, that convenience is important, because a lot of people work, a lot of people go to work and they can't leave their jobs.
They don't have the time to go to the hospital during those regular hours.
And some people, they can afford to see you at 5 a.m. Yes. You can have a doctor, talk to your doctor, this time will be convenient for me, that time will be convenient for me. And that works with us too.
Yeah.
So that's the concierge part of it. But mostly is to be able to reach you where you are, to make healthcare accessible to you, and for you to be able to care for yourself in a better way.
Good. Well,
Yeah.
that's great. So this TelMD can reach you where you are, can continue to see you after seeing you the first time, and and also you said to help you care for yourself in a better way, right?
Yes, so
Good.
that's where the quality comes in and the health education comes in.
Okay.
So I realize I've said this before, the Nigerians are more reactive than proactive towards
Okay.
their health.
Okay.
So when you become proactive and you are minding the things you need to mind, then you don't develop chronic health issues. If you already have chronic health issues, then you don't develop complications from those.
Yes.
And if you're already at a stage where you already have complications,
Yeah.
then the risk of morbidity, spending all your time in the hospital, in and out of hospital, and the increasing risk of death will help you manage it.
Okay.
So we go along with you throughout your healthcare journey.
Okay.
This is one of our catchphrases.
Wow.
That throughout your healthcare journey, from not having any health issue to taking care of you even to the terminal stages.
Yes.
So we play that role in your life.
Well, that's important because I'm glad you said that because that's what Vital Health has always been about, Vital Health International. I remember I used to tell our listeners, for those of you who used to listen, if you remember, I used to tell you that this is a journey and I'm going to stick with you through this journey. And you see how God does things. I'm not just sticking with you, but I have a lot of other people who are going to stick with you. And Dr. Toyin and her team are going to stick with you through the journey of life if you engage them. And that's, you see, I'm so excited when TelMD came around because these are some of the things that are lacking in our country. Our people don't have access to medical care. We don't have access to compassionate physicians who will work the journey with you. TelMD, that's something that TelMD will be doing. They will work this journey with you from where you are right now, regardless of where you are. Some of you may actually be assigned to specific doctors you are seeing. But guess what? If you are talking to TelMD and you're talking to top level physician, this is not just fly by night, just come out from nowhere, but this is a top level physician with a ton of experience who really is compassionate, wants to help you through this journey to ensure that you live your best life in the best medical condition possible with appropriate treatment where necessary and to ensure that you're getting the best attention as the need may arise. Dr. Toyin, thank you so much for making this sacrifice and thank you so much for making this commitment. I guess your services are free, correct?
The doctor also has to pay bills. I love to say I'm doing this for just altruistic reasons, but I have bills to pay. But the way TelMD works, we have our standard and our premium. So our standard care, we have made it so that we have made it as affordable as we can. For the urgent care, for the primary care. The primary care is an interesting thing. I do not know if a lot of Nigerians do this already. So it's a subscription service. It's like a membership, like if you go to the gym or if you use your DSTV, every month you get to pay. Every month you get to pay. You pay a fixed amount, and that allows you to be able to see your doctor. And depending on how you pay, depends on the amount of access you have. And we have our standard, like I said, and we have our premium. We have US-based physicians, US-trained physicians who can also see you on the premium service. So we have some Nigerian doctors who can also see you on both the premium and the standard service. So we're trying to meet every Nigerian where they are when we talk about being affordable. My partners are very, very passionate at being able to create something most Nigerians can afford. One of my partners actually told me before, I had offered something in a group and I was disappointed that people would rather pick 5,000 naira as a winning prize instead of an all-paid wellness package. And he called me and said, Toyin, you have to look at poverty and where people are. You've gone out of poverty for so long.
You've been out of Nigeria for so long. That's what it means. Yes.
That people will rather pay for their next meal than talk about paying for health.
Yes.
So think about it. So if I want to make this a viable option for Nigerians, we have to make the price such that it's not competing with other
major needs in their lives.
lives.
Yeah, so
Yes.
the price is such that it allows everybody an entry points.
We do not have an HMO. It's not an insurance thing. It's a subscription thing.
Yes.
So we have to pay our bills, like I said, but we are coming down to a point where most Nigerians can afford this.
Yes.
Like you can afford to pay for this every month, and you get to see a doctor.
Okay. Do you have those figures in your head, or you want them to go to your website?
They should go to our website.
Yes.
Because every day we're changing the figures as we tighten our budget and look at our overhead, and we see that we run our numbers. The numbers people run it, we see that, oh, we can still come down a little bit more so that more people can still be reached. So our mission and our vision goes in line with this, that we can provide health care for, if not all, most Nigerians. We can provide access as much as we can, and we can make this quality. Quality is always important. I think everyone deserves dignity, to be treated in a dignified way, and to get quality health care.
Wow, this is very good. Now, because this subscription thing is, I think that's one of the best way to go. If you remember, those of you listening, we had tried that at Vital Health International, but obviously my program would not even let me do a thing like that because of how busy we were. So you see, what Dr. Toyin and her team, what TelMD is doing, is the best way to go, because that way it allows for your own effective budgeting. Because when you pay that amount every month, now what does that cover, that amount every month? What does it cover?
It covers a visit with a physician.
Okay.
It covers nurses' education.
Okay.
And it covers you using sending in results, things like, oh, my blood pressure readings, my blood sugar readings.
Okay.
But that is the most basic. They are all tiers. So it covers all the way to you being able to see a doctor 3 times a month. Depending on the tier you choose.
That's right.
Yes.
And remember, these are foreign trained doctors who will give you the best attention and give you best diagnosis and follow up with you over a period of time. Thank you so much, Dr. Toyin. This is great. Because now, you heard her say repeatedly that they have bills to pay. But beyond that, the primary focus is not about the bills to pay. The focus about the bill, or the bill to pay, is to make sure that they are effective and they are there to meet your needs. Because the goal is to meet your needs. There are other people who, their goal is not to meet the needs. Their goal is just to make a fortune, can as much as they make, sit on the can and throw away the key of the can. But they want to meet your need. And in order to meet that need, guess what? There are bills that they have to pay in order to keep them running and functional. So that's the reason why. So if you have any concerns about that, when you go to the website, you'll get more information, and you can call and ask questions and make inquiries, and they will explain that to you. Now, before we went off the air, within the last 2 weeks, 3 weeks, we actually spent time talking about hypertension a lot. And of course, part of the reason why we spend so much time talking about hypertension is because common things occur commonly. We say that in medicine, and we know that the way the Nigerian demographics is going and the Nigerian population is going, it's reported that, based from studies that have been done, that over 40 million Nigerians will be having high blood pressure in the coming 10 to 15 years. And that's almost about 25% of the society. So that's huge. And then when we look at a lot of the other complications, now, hypertension is only one of those diseases we call silent killers. There are other conditions, and we'll be discussing some of that this evening, this evening. So we spent time talking about that, and one of the things you said, if I remember, Dr. Toyin, is that people need to they need to be proactive. They need to ensure that they carry out the lifestyle modification that will keep them healthy and keep their blood pressure under control, right?
Yes.
And one of which is they need to eat healthy.
Yes.
Yeah, not to take too much salt.
Not too much salt.
Not too much salt, yeah. You don't just apply the salt shaker on your food without tasting the food.
You shouldn't have a salt shaker.
You should, okay, hear that. Please hear that and write that down and put it on your fridge. Do not have a salt shaker. Whatever is cooked, go ahead and eat it. Don't put too much salt. Don't even put salt in your dodo. You said that.
No salt in dodo.
No salt in dodo, okay? And then what else? She said sleep well, right?
Yes,
Sleep well.
sleep well. We talked about sleeping 8 hours, where Dr. Joe pointed out that men need more sleep than women. I still have to see that study. I still have to see
I will look for that study and get it to you. You
Yes,
know,
and then distress. And
yes.
that was when we talked about yoga, and you were concerned about
Also
yoga.
yoga and,
But yoga
and
is great.
chanting.
We
Yes.
talked about that
Yes,
too.
yes.
Yes.
I'm
So
going to study. I'm going to take my word. I'm going to study some things about yoga, and I want to challenge you. Some of you, I'd like you to do yoga and send us an email and tell us. If you send us an email, the person who gives us the best response or the best change of habit and how you've incorporated yoga into your habit, we will send you a present. We'll send you a gift. That's a surprise gift. I promise you. TelMD will send you a gift if you've incorporated yoga into, well, perhaps, I hope I don't beat you to it, because I'm going to incorporate yoga into my,
yoga is
my
great.
practices. Okay, now, and when you get medications, how do you take your medications? Because some people say, I'll take the medications only when I'm in the hospital, or I'll take the medications only when I feel the symptoms. Remember, your emphasis was?
To use your medications every day, or like the prescription says.
Good.
Most medications are every day. Some of them are twice a day, some of them 3 times a day.
Okay.
So you ask your doctor, how should I use this medication? But remember, hypertension is not something that is cured. When you say something is cured, it means it's going away forever. Something like maybe a cold, you use medication and it's cured, it's not coming back. But hypertension is not something that you use a medication and doesn't come back. It is there, it is chronic. Most of the time it's lifetime, unless you can change your lifestyle, and this helps. And we say this is lifestyle control. Even then you're still managing it, because you're changing your lifestyle to manage it. So use your medications every day. Use it about the same time every day. Don't use it in the morning today and use it at night tomorrow. Some
Okay.
of them work maybe 24 hours, some 18, some 8. So use it the way it has been prescribed.
Okay. Okay, so that's very important that you do that. Now, you can reach Dr. Toyin TelMD on 0707 660 7330, 0707 660 7330 on IG, Instagram at TelMDNG, TelMDNG. Now, we didn't talk about hypertension in pregnancy, but we do know that some women do have hypertension in pregnancy. Yes.
Some women do have hypertension in pregnancy. At times it's that they've been hypertensive, they've had high blood pressure throughout pregnancy. At times it's that they develop high blood pressure while in pregnancy. For just plain high blood pressure, we say, oh, their blood pressure is more than 140/90 after 20 weeks of pregnancy. And some have this situation or this illness that we call pre-eclampsia, where they have the high blood pressure, but their kidneys start to leak protein. So that's the difference. So the pre-eclampsia is not a great thing while in pregnancy. It can affect the woman and even cause death if you look at the complications that can come from it. So you need to talk to your doctor, follow up with your doctor, let them treat you, and they'll be able to tell you at what stage you need to use medications and what medications you need to use.
Now, thank you so much for saying that. Now, it's important when you're dealing with a pregnancy, particularly high blood pressure in pregnancy, it's very helpful that you register in the clinic once you become pregnant. And that's important because they will know, or it's better if they even know your blood pressure before you became pregnant, your pre-pregnancy blood pressure. Because sometimes the blood pressure changes in a way that it looks within normal range when you're pregnant. It looks within normal range, but the change between the top level, which is a systolic, and the lower level diastolic is such that it has already put you in that pregnancy, hypertension in pregnancy zone. Let me explain that. If your blood pressure, for instance, your normal blood pressure when you are healthy is 100, let's say over 70, and then you become pregnant and your blood pressure now becomes, let's say, 120 over 85 or 120 over 90. It may look normal, but the fact that the blood pressure has increased by about 20 is already putting you in that hypertension in pregnancy range, even though it appears normal. So that's why it's important for you to register early. When you get married and you're thinking of having a baby, go and get your blood pressure, know your blood pressure readings, and once you become pregnant, attend the clinic early, get your blood pressure, and monitor your blood pressure through the period so that you don't develop complications. Like she said, when you begin to have eclampsia in pregnancy, where you're passing protein in your urine and the blood pressure is spiking and other complications set in, The baby's life is at risk, your own life is at risk, and the whole family is in disarray when we lose a mother who is pregnant.